Hello, ma'am. My name is Marcus Silva. I'll be taking care of you today. Is it okay if I can do your physical exam? All right. Let me go ahead and wash my hands. Can you tell me where we're at right now?
We're at the clinic.
Okay. What is today's date?
It's Thursday.
Okay. And do you know what's today? What's the year?
2022.
Okay. Patient has good mental status, very oriented, has good affect and manner, has a good level of consciousness, dressing great, good hygiene, and has a good speech. Now I'll go ahead and check the pulse of the patient. Checking the pulse. Now I'll go ahead and compare it bilaterally. Patient has good rate rhythm and pattern, also has normal respirations. Now I'll go ahead and place the blood pressure cuff properly. Go ahead and hold your arm right, ma'am. Okay. Placing the blood pressure cuff. I'll go ahead and check the patient's upper limit before checking the blood pressure. Okay, now I'm going to go ahead and palpate the brachial artery. Patient's blood pressure is 102/70. Now we're going to go ahead and check inspect the patient's skin. Go ahead and hold your arms out, ma'am. Checking for the temperature, moisture, checking for turgor mobility, checking for the nails, skin, checking capillary reflex. Capillary reflex are less than 2 seconds. Now we'll go ahead and inspect the head and face. I'm inspecting the head, palpating the head, no lesions, no cuts or any bruises anywhere with the heads. Go ahead and has a good cranium. Go ahead and open wide. Go ahead and close. Open again. Patient has good temporal mandibular joint movement. Now I'll go ahead and check the visual activity using the Snellen chart. So I want you to read left to right, okay? So can you read these letters for me?
EPTZO.
Second line?
CFDHJ.
Last one?
LTFPH.
Okay, now cover one eye and do it again.
EPTZO, CFDHJ, LTFPH.
Okay, cover the other eye again.
EPTZO, CFDHJ, LTFPH.
Good. Okay. Now I'm gonna flick my fingers to the sides and you tell me when to stop, okay? When you see them.
I see them. I see them. I see them.
Okay. Cranial nerve 2 is intact. Now I'll go ahead and inspect the patient's eye position and alignment. Eyebrows are in line, eyelashes as well. Go ahead and close your eyes, open your eyes. Okay. Now go ahead and remove your glasses. Now I'm going to go ahead and palpate the eyeballs, lacrimal gland and duct. So palpating the eyeballs, lacrimal gland, and lacrimal duct. Okay? Now go ahead and palpate, go ahead and visualize the conjunctiva. So go ahead and look up, go ahead and look down, sclera, okay? Now I'm gonna go ahead and check the anterior chamber. Okay, right eye, good. Okay, now we're gonna go ahead and determine the pupillary size light to reaction. So we're gonna go with direct, concentric, other side, direct, concentric, okay? Now I'm gonna go ahead and do an extraocular muscle movements. Go ahead and follow my pen. Try not to move your head. Good. Okay. Cranial 3, 4, and 6 are intact. Now I'm gonna go ahead and perform a fundoscopic exam. Okay. Red bleed reflex is identified, as well as the bundles, visualizing the bundle structures. Going to the other side. Red reflex is identified, as well as the bundle structures. Now I'm going to go ahead and inspect and palpate the patient's ears bilaterally. So checking out the ears. Okay. Palpating the auricle, helix, the tragus. Now I'm going to go ahead and perform an otoscopic exam. So first, we're going to identify the external auditory canal, visualizing the cone of light, the tympanic membrane. Other side on the right ear. Visualizing the external auditory canal, visualizing the tympanic membrane and cone of light. Now I'm going to go ahead and perform a Weber's and Renee's test. So I'm going to go ahead and make a sound. Once you don't hear anymore, you let me know, okay?
No. No.
Okay. AC is greater than BC on the left ear. Now for the right ear.
No. No.
Okay, now I'm gonna go in and place this on your forehead. You tell me when you hear it on both sides equally, okay?
Yes, they're equal.
Okay. Now we're gonna go ahead and perform a whisper test. I want you to cover one ear. I'm gonna go behind you, and you let me know what I'm telling you while I'm whispering to you, okay?
Mm-hmm.
So go ahead and cover your left ear.
Basketball.
Okay, now cover your right ear.
Baseball.
Okay. Cranial nerve 8 is intact. Now go ahead and inspect and palpate the external nose and nares. Inspecting, everything is good. Now we're gonna go ahead and palpate the frontal sinus, maxillary sinus. Now we're gonna percuss the frontal sinus, maxillary sinus. Okay. Now we're gonna assess the patient's patency and nares. So go ahead and cover one nostril. Go ahead and breathe in, breathe out. Cover the other one, breathe in. Okay. Now I'm gonna give you something to smell. You let me know what you smell. Go ahead and close your eyes. Cover one nostril. What do you smell?
Lemon.
Okay, switch. Breathe in, breathe out. What do you smell?
Peppermint.
Okay. Cranial nerve 1 is intact. Now let's perform a nasoscopic exam bilaterally. Now go ahead and check the nasal mucosal, septum, and turbinates. Go and look up for me now. 3 structures are identified on the other side. Same on the right nostril. Now I'm going to go ahead and inspect the mouth and pharynx. Now I'm going to inspect it with the light. First we'll check the lips. Buccal-mucosal open. Good. Teeth and gums. Hard and soft palate. Go ahead and stick out your tongue. Lift it up. Okay. Stick out your tongue. Move it side to side. Okay. Visualizing the pharynx and tonsils. Go ahead and say ah. Good. Cranial nerve 9 is intact. Okay. Now go ahead and raise your eyebrows. Okay, now normal. Go and smile. Okay, make sad face. Puff out your cheeks. Okay. Cranial nerve 7 is intact. Now go ahead and inspect the thyroid. Now palpate the thyroid. Okay. Now palpate it more. Okay. Go ahead and swallow. Okay. Other side. Swallow. Good. Now we'll palpate the patient's lymph nodes bilaterally. First, I'll start with the preauricular, postauricular, occipital, consular, submandibular, and submental, superficial cervical, posterior cervical, deep cervical, and subclavicular. Okay, now we'll check the epitrochlear. Go ahead and hold your arms like this. Good. Okay, now relax. Go ahead and shove your shoulders down. Again. Good. Cranial nerve 11 is intact. All right, now we're going to go ahead and inspect the anterior posterior lateral thorax of the lungs. So checking the anterior portion. Go ahead and lift up your arms, checking the lateral portion, not checking the posterior portion. Now I'm going to go ahead and palpate anterior posterior lateral thorax of the bony landmark. So we'll start with the clavicular. Palpating the clavicular, the sternum, jugular notch. Now we'll go ahead and do the angle of the scapula, the vertebra prominence, T12, and the xiphoid. Okay. Now I'm going to go ahead and do tactile firmness. So what I'm going to do is I'm going to go ahead and place my hands in 3 portions of the front area and the back area, and I want you to repeat 99, okay? So go ahead and repeat it.
99, 99, 99.
Okay, other side, the posterior side.
99, 99, 99.
Good. So we'll go ahead and start by percussing the appropriate pattern over the anterior and posterior portion of the thorax. Also, we'll start from the behind area. So lateral portion. We'll do that on the right side as well. We'll do it in the anterior. Good. Now we'll go ahead and auscultate on the skin. We'll start with the exterior by using the diaphragm. Go ahead and breathe in, breathe out. Other side, breathe in, breathe out. Again, breathe out. Other side, breathe out. Again, breathe out. Again. Good. Now we'll start with the lateral portion of the auscultation. Breathe in, breathe out. Go ahead and breathe in, breathe out. Other side. Breathe in, breathe out. Other side. Good. Now we'll start with the posterior portion. Breathe in, breathe out. Other side. Good. Again. Okay. One more time. Good. Okay, now we're going to go ahead and inspect the patient's heart. Go start with the heart exam. I'll pull out the leg tray. Go ahead and place your feet right here. And I'll give you proper instructions for the draping. First, we'll go ahead and inspect the neck, carotid pulses, and the jugular veins. So we're going to go ahead and inspect the neck. We're going to go to the other side. Okay. Palpating the carotid artery. Okay, now I'm gonna go ahead and auscultate the carotid arteries bilaterally. Good. Now we're gonna go ahead and check for heaves and thrills. So we're gonna go heaves, thrills, other side, heaves, thrills, right here, heaves, thrills, heaves, thrills, heaves, thrills. Now we're gonna go ahead and check the patient's, I mentioned the patient's jugular vein. Okay. Go ahead and tilt your head to the left side. Okay. I first identifying the internal jugular vein. It is identified. Now we'll go ahead and measure it. Jugular vein with normal limits being 0.5 centimeters. Now I'm going to go ahead and auscultate the cardiac points on the skin. Changing to the bell. Go ahead and move a little bit to the left side. Right there's good. Checking the radial pulse. Pulses are symmetric. Now we're gonna start by doing an abdominal exam. We're gonna go ahead and inspect the 4 quadrants of your abdomen. Is it okay if I do that? Okay, proper drainage is assessed. Now I'm gonna go ahead first and auscultate the skin before percussion and palpation. So I'm gonna go ahead and start by doing it. Okay. Now I'm gonna go ahead and listen to the abdominal aorta and renal arteries by using the bell. Renal arteries. And the femoral. Okay. Now I'm gonna go ahead and percuss the 4 quadrants. Light palpation, deep palpation, rebound tenderness. Any pain? No? Good. Now I'm going to go ahead and percuss the liver and determine its span. Liver percussing. Now we're going to go ahead and determine the span. Okay. Liver is 5.5 centimeters. Now we're going to do the same thing with the spleen. Okay, spleen is within normal limits. Now I'm going to go ahead and palpate both of the kidneys. So right here, take a deep breath. Okay, on your side. Breathe out. Okay. All right, now we're just going to inspect the upper extremities. Now let me go ahead and take out the tray. Go ahead and sit up. Okay. Now I want you to follow what I tell you to do, okay? Go ahead and follow me. Say yes. Say no. Say maybe. Other side. Go in circles. Other side. Good. Now I'm gonna place my hand on your head, and I want you to put force to it. Okay? Don't let me push you back. Okay? All right. Push you back. Sides. Other side. Okay. Now I want you to go ahead and hands up, hands down, forward, back. Okay. So I'm gonna go ahead and do the same thing for you. Right here, up, down, side. Same thing. Up, down, side, side. Okay. Now I'm gonna do your shoulders. We already did the shoulders, my bad. Now the elbows, go ahead and make a curl. Again, do it again right here, extend it out, twist like this, twist out like that, open your fingers, close your fist, turn it around, open it, close it, again, close it, okay, relax. For you, same thing over here, okay, now give me your hands, twist it, other side, open your fingers, close them, okay, go ahead and open them again, close it, turn your wrists, turn them out, okay. Now I'm gonna go ahead and push against your arms and don't let me push them away, okay? So, okay, same thing. Same thing with the wrist. Other side. Okay. Now I want you to grab my fingers and I want you to pull. Okay, now go ahead and make two fingers like this. I'm gonna go ahead and pull, okay? Don't let me pull you. Okay. Well, that is all for today, ma'am. Thank you for the physical. Let me do your physical, okay? Thank you. Yeah.